Chapter 27, Therapeutic Agents for the Dermatological System. I'll skip past the terms and definitions, but we will go through them in the chapter. And in the beginning of the chapter, we have the common drugs for conditions of the dermatological system. And we have the pronunciations over here for the generic names. So very good tool to practice your drug names with. The dermatological system, in its widest sense, involves conditions affecting our skin, scalp, hair, and nails. The skin is one of the most abused organs of the body system. It withstands damage from water, detergent, scratches, cuts, bruises, and it continually is repairing itself. The skin protects the body, regulates temperature, and acts as a sensor to outside stimuli. Various layers that contain nerves, glands, hair, and blood vessels from skin are the largest body organ, skin. Skin protects the body against heat, cold, light, dehydration, and infection. Nerve endings allow for the perception of pain, heat, and cold. The body is mostly covered with hair follicles embedded in the dermis. The top portion, the epidermis, further divides into three main layers: the horny outer layer, squamous cells, and the basal layer. The epidermis is the outermost layer and it protects the layers below. It contains melanocytes, which produce the skin pigment melanin. The epidermis does not have a blood supply of its own. Instead, it receives nutrition from the tissue surrounding it. It constantly sheds and replaces epidermis cells. The basal layer produces new cells. The new skin cells push older cells upward, and this becomes the outer epidermis layer. Beneath the epidermis are the dermis and the subcutaneous layers. The dermis is a thick layer of connective tissue that contains collagen. The dermis is under the epidermis. Below the dermis lies the subcutaneous layer, or hypodermis, the deepest layer. It contains fat cells for insulation, and fat also helps cushion the body against injury and serves as an energy reserve. A protein called keratin is the primary component in hair. Hair has roots embedded in the dermis. The base contains melanocytes that are responsible for our hair color. As a person ages, the melanocytes stop producing melanin and the hair turns gray. The hair follicle is vascularized to provide nourishment to the follicle. Hirsutism is an excess of hair growth, whereas alopecia is the loss of hair. Medications and medical conditions can cause both. Like hair, the nails contain keratin and are much denser than hair. The nails cover the top surface at the end of toes and fingers. The nail root embedded in the epidermis, protects the surface. The lunula is the small white portion at the nail's base. The cuticle has keratin at the base and sides of the nail. The pronotum surrounds the nail and consists of a softer tissue. The two types of glands in the skin layers are sebaceous glands and sweat glands. The sebaceous glands in the dermal skin layer secrete an oily substance called sebum. Sebum lubricates the skin and retains water to keep the skin and hair from drying out. Ducts transport sebum into the hair follicles where the oily substance remains. Sebaceous glands are everywhere on the skin except hands, palms, and foot soles. Sweat glands are much smaller than sebaceous glands and are prevalent in hand, palms, and foot soles. Sweat contains mostly water and salt. When sweat glands activate, sweat escapes through our skin pores. As the temperature rises, the nervous system signals the glands. Perspiration is the flow of sweat to the skin's surface. The subsequent evaporation cools the skin. Many conditions affect the skin. Over-the-counter medications can relieve some issues such as acne, sunburn, hives. Others may require treatment by a doctor, such as infections, skin disorders, and impetigo. So seborrhea, comedones, papules, pustules, and nodules, and potential scarring categorize acne vulgaris, a common skin condition. Acne most commonly affects skin with a high density of sebaceous glands, such as the face, chest, and back. Severe acne cases have inflammation. However, acne can present without inflammation. Because testosterone increases during puberty, acne occurs most commonly during adolescence. However, it can extend into adulthood. Hormones can enlarge and activate skin glands. Two productive glands are the sweat glands, which can become clogged, and the sebaceous glands, which produce sebum. When sebum production increases, it traps bacteria at the hair follicle base, and the likelihood of acne increases. The increased androgen production during puberty leads to increased sebum production. Mild acne often responds to topical agents such as benzoyl peroxide, which helps dry the skin, and salicylic acid, which increases skin turnover. More severe inflammatory acne may require topical or systemic antibiotics such as tetracycline, erythromycin, and clindamycin. Topical retinoid agents such as retin-A micro increase skin growth around the acne areas, which causes skin exfoliation, which is removing dead skin cells and decreasing comedone formation. So we have the select agents for the treatment of acne. We have topical products. iPledge is a program aimed to prevent pregnancy during isotretinoin product use. It educates patients and prescribers about potential side effects and risk of isotretinoin treatment. If you work in retail, you will know a lot about iPledge, and we will talk about that more later. Urticaria is also known as hives. These superficial bumps range in size and are commonly associated with pruritus. Hives are generally caused by hypersensitivity reactions to food, the environment, or drugs, and they can occur anywhere on the body. Sometimes topical agents mitigate hives and other non-infectious inflammatory skin rashes. Some cases of urticaria are idiopathic or of unknown cause. They can disappear as rapidly as they appear. Diphenhydramine is indicated for hives, itching, and rashes. It's Benadryl. You can get it over the counter. It is available in oral capsules, liquid, topical products. Eczema, also known as atopic dermatitis, is a chronic inflammatory skin condition thought to involve a genetic defect in proteins that support the epidermal barrier. Eczema may have pathophysiologic immune component, therefore some of the following treatments affect the immune system. Eczema may affect 5 to 20% of children worldwide, and the prevalence is approximately 11% in the US. Table 27.2 lists select agents for the treatment of eczema. We have topical corticosteroids, topical calcineurin inhibitors, oral calcineurin inhibitors, and immunosuppressants. We have the medication Protopic. It is indicated for eczema and atopic dermatitis. One of the side effects is increased risk of sunburn, meaning if you put this medication on topically and then you go outside, you're going to get burnt more easily than you would normally. And if you already are a person that gets burnt pretty easily, you definitely do not want to go outside with this on your skin. And also the medication Elidel has the same risk, as do many of these medications. Psoriasis is a common non-infectious, painful, inflammatory skin disorder that has been related to genetics, especially cases with an early onset of 40 or younger. The disease can range from mild to severe and can last a lifetime. Onset usually happens in one of two peaks between the ages of 20 and 30 or 50 and 60. This condition is not contagious, although lesions appear inflamed. Affected areas are typically around the joints, limbs, neck, and even scalp, and can appear as small or large plaques with silvery scales. So here is a picture of psoriasis. For mild psoriasis, the use of a high-quality moisturizer keeps both the skin moist and helps control flare-ups. Emollients that trap moisture work the best. Phototherapy or ultraviolet exposure treatments may be used to cause mild skin sunburn and subsequent healing in patients with more serious disease. This is based in part on the observation that patients often notice improvements in skin lesions during the summer months. This process is done gradually over many months with UV light. The UVB wavelength is the only treatment that requires fewer sessions. We have in table 27.3, select agents for the treatment of psoriasis. We have corticosteroids, tree bark extract, vitamin D analogs, topical retinoids, anti-metabolites, and an anti-psoriatic agent, coal tar preparation, and monoclonal antibodies, TNF inhibitors, tumor necrosis factor inhibitors, calcineurin inhibitors, and psoralins. We also have oral retinoids like soriatane. Chickenpox is a contagious disease and it may cause serious complications in young children. Typical non-serious symptoms include skin blisters, fever, and an itchy rash. Some people can experience more severe effects such as brain damage, pneumonia, infection, or rarely even death. A pregnant woman who contracts chickenpox may require hospitalization. Another disorder caused by the same virus that causes chickenpox is shingles. This may appear in adulthood in those who had childhood chickenpox. After lying dormant for several years, the virus can activate and cause acute dorsal root ganglia inflammation. Symptoms include painful lesions along the nerves, and shingles treatments include medications such as oral or intravenous valcyclovir. A prescriber can use acyclovir over a 7-day period to reduce pain and promote healing. In 2006, a drug manufacturer introduced a single-dose vaccine for adults older than age 60. This vaccine prevented shingles in about half the subjects tested and can reduce pain. Those who should not be vaccinated include pregnant women or immunocompromised individuals. If the disease is contracted through immunization, only a mild form results. And 27.9 shows chickenpox. The medication Veltrex is indicated for herpes zoster infection. So it is used for genital herpes. It's used for cold sores, which are another type of herpes. And it is also used for shingles. Burns range in severity from superficial to 4th degree. 4th degree burns are the most severe. If the burn degree or burn size is substantial, the patient may undergo surgery to replace the damaged skin layers. Surgeons do this by removing and grafting healthy skin from another body part. Burn hospitals require specialized solutions and medications from the pharmacy to treat burn unit patients. Patients can normally treat 1st degree burns at home. Box 27.1 lists the definitions of burn depth and severity. Superficial is when only the outer layer of the skin is burned. The skin becomes red and swells, and pain is often present. They do not blister. They are painful, and they are dry, and they have red and blanch with pressure. Superficial burns are commonly sunburns. Partial thickness, the first layer of the skin burns through to the second layer. So from the epidermis to the dermis, these burns can be further classified as superficial or deep. Superficial partial thickness burns characteristically form blisters within 24 hours. Deep burns almost always blister and are patchy white to red and do not blanch with pressure. Full thickness, the burn extends through and destroys all layers of the dermis and often injures the subcutaneous tissue. 4th degree, the worst burns. The burn penetrates the deepest layers of the skin, including the muscles, tendons, and bones. 4th degree burns may be life-threatening. A very popular medication for burns is SDD, Silvadene, silver sulfadiazine. it is used for prevention and treatment of burn wound infections. So even if you had a small burn and you went to the ER or something, more than likely they're going to give you this to take home, like a prescription to take home. Warts are a virus and they are a skin growth. Verruca plana or flat warts commonly appear in children and may emerge on the hands, face, and neck. Plantar warts can present on the foot's bottom and can cause tenderness on walking. The human papillomavirus, HPV, causes common warts. A doctor can provide treatment which may include drug treatment, liquid nitrogen freezing, or surgical removal. Genital warts are different from common warts and come from specific strains of HPV. Genital warts are a sexually transmitted disease. So here's the different warts. A is the HPV common wart. B is genital warts. And C is other genital warts. Salicylic acid, it's over the counter. You can find it under compound W or many other things. Athlete's foot can cause severe infection and inflammation of the skin on the entire sole and may include relentless pruritus and pain when walking. The affection can spread by contact with shower floor surfaces or clothing, for example, by sharing socks. Direct contact is required for transfer of the fungal infection. So you can also get fungal infections of the bearded skin, hair of the head, ringworm of the skin, groin, hands, nails. And here are some select topical agents for the treatment of dermatological fungal infections. So we have topical antifungals, Desonex over the counter, Lamisil over the counter, Lotrimin over the counter, but insurance does sometimes pay for the generic. Nizoral, that is prescription only, and Nistep is prescription only. The Nizoral has a shampoo, so you can assume that that's given for infections of the head. And here's just some more information on these over-the-counter products. So impetigo is impetigo is a highly contagious infection caused by streptococcal organisms. The bacteria can enter the body through broken skin caused by animal bites, injuries, trauma, or insect bites, although impetigo may appear without a skin break. Potential affected areas include the face, limbs, and abdomen. A thick yellow crust characteristically forms. Sores are often itchy and oozing, and blistering is common. And we have select topical antibacterial products, bacitracin, which is over the counter. Bactroban does require a prescription. Neomycin you can get over the counter. Neosporin, your triple antibiotic ointment, you can get over the counter. And Ultibax is prescription only. Any abnormal growth of new tissue that results in a malignancy is known as skin cancer. Melanomas are cancerous skin growths emanating from moles and areas of the skin that may have been sunburned. The three main types of skin cancer are melanoma, squamous cell cancer, and basal cell cancer, which is non-melanomas. The most aggressive and severe type of cancer is melanomas. Melanomas typically appear as an irregular shape elevated off the skin. They are discolored and change in size. These can occur anywhere on the body. Melanomas start in the lower part of the epidermis in the melanocytes. Individuals with light-colored or freckled skin, red and blonde-haired people, and Caucasians aged 20 or older are at higher risk. The normal treatment course depends on the cancer stage or severity. Basal cell cancer grows very slowly, occurs on the skin surface, and often comes from sun damage. This cancer typically appears first on the face and rarely spreads to other areas. Squamous cell cancer normally occurs on parts of the body other than the face that have been overexposed to the skin. This cancer type can spread to lymph nodes and metastasize to other organs. So most of the time skin cancer can be treated, but if you were to let it go and not get it checked out, it can spread to other organs and be possibly not treatable, depending on how bad it gets. You can read for instructions for detecting possible skin cancers. So the parasite head louse causes head lice. Many children come home from school with head lice. Lice transfers easily with hairbrushes and hats. Other ways to transmit lice include sleeping next to or sharing clothes with someone with lice. Symptoms include itching, head sores, and a feeling of something moving in the hair. Several products treat this infestation. Treatment of the whole family is important, even if the infestation appears to affect only one child. So yeah, it is very important that everybody in the household is treated, even if they don't have any lice on them. And also your house needs to be clean, like bedding needs to be washed, any stuffed animals need to be put away. So it's a whole process. Another type of lice spread through sexual contact affects the pubic area. It is commonly called crabs. Lice can live on leg hair, armpits, mustaches, beards, eyebrows, and adult eyelashes. If lice are on a children's eyelashes or eyebrows, it is considered head lice. Symptoms include pruritus and visible nits, which are lice eggs, or crawling lice in the genital area. So the Nix permethrin is approved for topical use for lice. You apply it in your head and your hair, and you can read the whole directions there. And that same permethrin is used for like scabies, and I'm assuming crabs if it's treatable. It doesn't really say. Onychomycosis is a fungal infection of the nails, the most common nail disease, and it starts at the tip of one or more toenails. It produces thickening, discoloration, and nail crumbling, possibly affecting the entire nail. We typically treat it with topical agents. If a fungal infection becomes systemic, like throughout the body, a doctor may prescribe oral agents such as ketoconazole or fluconazole. Lamisil, the cream, also comes in a tablet that's prescription only, and it is indicated for onychomycosis. And just a tech note, soap and water have always been a good way to remove bacteria from the skin. However, they do not necessarily kill all bacteria. Antiseptics are necessary for the healthcare worker because they do kill and or inhibit the growth of germs. Unfortunately, both bad and good germs are killed when these agents are used. It is wise not to overuse antiseptics because bacteria can mutate into strains that become resistant to them. Using gloves can reduce the necessity of constant hand hygiene and also keep the skin hydrated.